Hi, everyone. Welcome and thank you for joining. I'm Christine, Manager of Public Affairs and Advocacy at Friends of Cancer Research. Today, we will discuss the mission, the need, the value of progresoparapacientes.org with our panelists, briefly share the program's impact, and explain how you can integrate the program into your training pipeline. Before we begin, I'd like to share a bit of background on progresoparapacientes.org, our new advocacy education program we launched earlier this year. The program is a Spanish language version of progressforpatients.org online advocacy education course, which overviews the FDA's role, clinical trials, regulatory pathways, and the advocacy's impact on research and policy across all disease areas. So how did it all start? We originally developed Progress for Patients in 2018 because there was a structural gap where, despite patient advocates and caregivers having the critical lived experiences that can inform clinical research and policy, there was no comprehensive foundational education resource that could support advocates and empower them to confidently participate in these research and policy discussions. Without that baseline knowledge, it can be difficult for advocates to fully participate in conversations that shape research and care and policy that ultimately impact their health outcomes. We learned that these gaps are even more stark when there is a huge language barrier and we have so many Spanish-speaking Latino and or Hispanic populations in America who have even more challenges with accessing educational materials that explain these concepts. So we reached out to an amazing group of Latina advocates we have here today who helped us translate and adapt the English course to Spanish so that it would be both linguistically accurate and culturally responsible, recognizing that Spanish-speaking communities are diverse with different linguistic nuances and contexts. And before we dive in, I want to clarify that when we say patient advocates, we mean patients, caregivers, and anyone with lived experience who works to elevate patient and community perspectives to help improve research, care, and policies that affect people impacted by cancer or other health conditions. That said, Barbara, Debbie, Diana, and Yadira, let's do a round of introductions before we jump in.
Okay, I'll start. My name is Barbara Segarra Vasquez. I'm a professor at the University of Puerto Rico and a two-time breast cancer survivor.
Good afternoon. I'm Debbie Denardi. I'm a patient and research advocate. I'm a triple negative breast cancer survivor, and also I carry a BRCA1 and Lynch syndrome mutations. I'm a volunteer with FORCE that is facing our risk of cancer empower, and other organizations such as COMEN, Florida Breast Cancer Foundation, the American Cancer Society. My research advocacy started when I had the experience with a program called GRASP. In that program, they designed to connect patient advocates like me together with researchers. After experiencing the impact that these interactions had, I started reviewing grants for the Department of Defense, for CPRIT, for ASCO, for COMEN, and I'm also a patient advocate with multiple studies, allowing me to share our patient experiences with researchers. I'm passionate about patient education and access to care for our Latino community. Learning about the FDA and drug development is critical to offer more treatments for cancer patients. Thank you.
Wonderful. My name is Diana Marino Vega, and I currently work as Senior Director of Early Cancer Detection and Screening at AstraZeneca. And I volunteer for several research groups and advocacy organizations such as Childhood Cancer Survivors Canada, St. Jude Children's Cancer Survivor Study, and the Pediatric Oncology Group of Ontario, among others. My personal experience as a childhood cancer survivor and my innate curiosity has led me to pursue a career as a cancer researcher, and my passion for improving the lives of patients and survivors has empowered me to become a patient advocate. I used to work at Friends of Cancer Research, where I got to learn about the power of patient advocacy to accelerate the development of life-saving medicines. And I've taken that information learned through Progress for Patients to empower other patient survivors and their families, as well as their communities. It's a pleasure to be here.
Good afternoon, everyone. My name is Yadira Montoya, and I serve as the Programs Director at the National Alliance for Caregiving, or NAC for short. We're an organization dedicated to transforming how this country values and recognizes family caregivers through research, advocacy, and narrative change. My individual work sits in the intersection of health equity, family caregiving, and community-centered approaches. And this path is really shaped by my personal experience being a Latina immigrant who grew up interpreting, advocating, coordinating for my parents within the healthcare system. And they really drive my goals, my personal and professional goals in terms of healthcare being a human right and also accessible and inclusive of all communities. Specifically at NAC, I oversee some large initiatives that focus on how family caregivers are recognized and supported, especially as they're navigating complex illnesses such as cancer or have or are candidates to receive a transplant. And much of this work involves working directly with and for family caregivers to inform, shape, and advocate for policies and practices and research that is inclusive of family caregivers and building a system that truly works for all of us as individuals, families, and communities.
So Christine, if I can, because I think I was a little bit short, so I just introduced myself without saying a few of the things that I do when I'm not sleeping. So I would like to add that I have served in different organizations locally here in Puerto Rico and also at the mainland, including Susan G. Komen in Puerto Rico. We have an affiliate, and that was actually where I started. And then I've been part of the Puerto Rico Cancer Coalition, the American Society for Clinical Oncology, among others. And currently I serve as the co-chair of the Patient Advocate Committee at SWOG Research Cancer Network, which is a global cancer research community that designs and conducts clinical trials to improve cancer prevention, treatment, and survivorship. I have served in SWOG in the cancer care delivery for 7 years. And my involvement at SWOG has helped me understand the complexity of clinical research and the role of FDA. So that's why when I was invited to participate in this initiative, I was thrilled because I think we have a huge need for it. So thank you.
Well, thank you, Barbara, for expanding on your introduction. I'm glad to get to know everyone. And thank you all for sharing your stories and different paths that led you to advocacy and your current roles. And I also want to give a huge shout out to each of you for serving as advisory committee members for this program and for the advocacy work you continue to lead in your communities. Your insights and feedback were so important in shaping this course. So with that, let's get to it. So our first question for this webinar is, many advocates begin their journey in different ways. Can you please share how you found your footing in the advocacy landscape and where advocates can meaningfully engage beyond just clinical trials in this broad ecosystem of policy and research and drug development? And let's start with Barbara.
Yes, thank you. My advocacy began locally, right? Doing fundraising, volunteer for Komen that I mentioned, and I was actually part of the education committee and then president of the board for 4 years. And then after a few years, actually in 2012, after my first diagnosis, I attended AACR Scientific Survivorship Program, where they put together advocates and researchers for this meeting of AACR. And through that experience, I learned that I could be a research advocate. And after that, I started doing grants review for DoD. I attend many scientific conferences, which helped me develop my skills and learn more, and work directly with researchers to help shape their research study. I still assume many roles, and part of what you mentioned is advocates can do many roles, from policy to helping others to working directly with researchers. And I, take advantage of the different opportunity, but the one I never say no is when a patient is newly diagnosed that they need somebody to talk to. So I'm always there to really help, and people get encouraged after I tell them that I've been a survivor for 22 years. So that's where I began and continue my work. Thank you.
And Debbie?
Yes, after my diagnosis, as I carry two mutations, I started volunteering with Force by offering information and resources to newly diagnosed patients and families. But later, I decided to learn more. So I started attending local conferences because I wanted to learn a little more about early diagnosis, treatment options, and also survivorship, as I was a survivor. Two conferences helped me to learn more about the science behind cancer. I'm an accountant by training, so this was really difficult for me, but I was able to learn this by attending first Project Lead, and then the same program as Barbara mentioned, the SSP program, that is the Survivor Scientist program that is offered by the AACR. This knowledge helped me to be able to interact with those researchers and work with them in grant proposals, research studies, also by recruiting patients, that is so important, and also reviewing grants to provide my feedback about the impact that these treatments have on patients. Thank you.
Yeah, I'll continue with that. So I just briefly shared about how I'm a cancer researcher, and my interest in cancer research stemmed from my own personal experience. But patient advocacy is something that I had to come to terms during my adolescence and young adulthood. And I think, Christine, your question was, how is it that we found our footing here? And I think it wasn't linear. It wasn't something that I had set my head to, but it was out of a desire and a passion to make a difference and make a change. So I think that what I've noticed is that a lot of people want to make a difference and they want to do something, they just don't know how. And maybe my encouragement is that you don't need to go to Capitol Hill. You don't need to do things that perhaps people have an idea of what a patient advocate should look like, but there are things like confidence and empowerment that comes from just understanding what the patient needs and what are some of those gaps that need to be addressed. Knowing about the ways in which drug development works helps identify those gaps, and just making sure that a patient's voice and the patient advocate's voice is heard alone makes a lot of change, even if we don't think it does. Um, during like if somebody wants to be a little bit more official about it, there are avenues in which advocates can engage in drug development. This includes grant and clinical trial reviews, patient advisory boards, policy discussions. So there's a variety of different ways in which patients can be encouraged to participate in patient advocacy.
Thank you. And we'll go to you, dear.
Yeah, and throughout my career, I've worked in research and still work in research at NAC. And this has been all sorts of research, social science, clinical trials, and epidemiological studies, particularly with medically underrepresented groups like Latino immigrants, Spanish speakers, and older adult, and the intersection of all of those identities. And it's involved, I've done, recruiting of participants, collecting the data, and then translating the findings back to the people who made research possible. And this has allowed me to see research up close and how, not only how studies are designed, but what gets prioritized, and just as importantly, who is left behind, who is left out of those decisions and that design and that process. And very early on, I learned that both proximity and perspective are really important for meaningful advocacy. And so when when I understood how decisions were made, and it's really it's much easier to see the gaps. And especially when studies don't really reflect the lived experiences or the needs of individual families or communities, when participation isn't possible because of language barriers or geographic accessible and location, or when I think the thing that happens most often when dissemination doesn't get to the people who made the work possible. I think all of this knowledge has been powerful and has allowed me to not only identify all of these kind of barriers and things that are not working or not happening, but also to propose and advocate for solutions, to build partnerships, to sign up for opportunities like this one with Force and push for systems that are more inclusive and equitable.
Thank you, everyone, for sharing your stories. That's powerful, and echoing Diana on how it's not linear where we find ourselves here. As a young adult, I was also diagnosed with thyroid cancer and learned so much by joining Friends of Cancer Research and expanding my advocacy work from herein. So, building on the many ways that advocates can engage across research, drug development, and policy, how can programs like progresoParaPacientes.org can help advocates feel more confident in engaging in research conversations, working with their clinicians or clinical or policy stakeholders? We can start with Diana.
Yeah, I'll start. Um, I think understanding or just being aware of how things work opens up our eyes to all the possibilities in which we can make a difference. So, even learning a little bit about the drug development system, it enables meaningful participation. Patients and caregivers already have agency. Simply knowing that trials exist and asking questions already makes somebody an advocate. Um, like I said before, everybody can have an impact, and it could be an N of one with you going in with somebody into the doctor's office, or you yourself asking the right questions at the doctor's office, um, as it can be, the activity that happens on Capitol Hill. I think being informed, asking relevant questions to doctors, nurses already kind of starts that. And Progreso para Pacientes gives you that awareness and gives you that understanding and information. I have found that the knowledge that I have on drug development has helped me support, for example, a young friend who was just recently diagnosed with breast cancer. Just being there beside her side, listening to the doctor, translating for her, asking questions on her behalf, and just helping her understand more, gave her that confidence that she needed. So understanding is huge, and the information available through Progreso para Pacientes is so crucial.
Thank you. And Debbie, if you'd like to provide input.
Yes, thank you, Diana. That was really very comprehensive. It was really very good, all the points that you made. What I wanted to add is that by us being patients or caregivers, we are experts on patient needs. So at the beginning, when I was just diagnosed, I didn't feel that I was able to contribute much. But after that, after I started with my training and everything, I started listening to other patient advocates like we have to here today, and I gained the confidence to share my story and to learn a little more about the FDA and how the drug development is done and how it works to benefit us patients. So really everybody has something to contribute, and by learning more, we can help other patients.
Thank you, Debbie. And Yadira, I'd love to hear your caregiver perspective in this landscape.
Sure. And this will be, this will be a little bit repetitive because I agree with so much of what Diana and Debbie shared. But this piece about programs like Progreso for Pacientes providing access, knowledge, and information, and that advocates and patients and caregivers already have a lived expertise and experience that they bring to the table. It's the ability to ground that confidence and to understand the history and, let's say, the purpose of the FDA and the process of the drug development process that is really essential for individuals and patient advocates to engage in conversations and policy questions. I think bringing the community perspective, bringing in like that family perspective is also something that I think is really needed. And I'll just name it, but I think the other piece is what I alluded to earlier about kind of historically what voices, what perspectives have have been left from study designs and processes. It gives us that confidence and that ability to say, you know, like, this is what's missing. These are the populations that are not sitting in the table. How are decisions being made? How are we centering patients and family caregivers? And that calling out and naming of like who's not here and this design isn't working for us is really important. And I think that that's one of the key things as I look at the Progreso para Pacientes program. It's that foundational knowledge that allows folks, individuals, patients and individuals to then kind of ask these questions in these pushing back and interrogation questions that are needed and important so that we can all participate as equal partners in policy and healthcare decisions.
And Kristen, if I may, I would just add a sentence like knowledge is power, right? And I think when they talk about shared decision making, you cannot share a decision if you don't have the information. So we need the patients, and sometimes they are underestimated that they won't understand. They will, and they become expert, like Debbie was saying. So I would summarize that knowledge is power.
Absolutely. I wholeheartedly agree. So, what I'm hearing across your experience is that confidence in advocacy often begins with understanding how research and regulatory system works and realizing that patient advocates and caregivers already bring valuable insights and lived expertise to these conversations. And the programs we have, Progreso para Pacientes, progressforpatients.org, were created to connect those lived experiences with foundational knowledge about clinical research and the FDA. These are all very important perspectives. And yes, patient voices matter, and we know what's going on as long as we're equipped with the right resources to understand the systems. And with that, I'd like to briefly share a few examples of the impact we've seen so far among our Latino Hispanic advocate learners who took Progreso para Pacientes. So that said, here we go. So we evaluated the course's impact through pre and post course surveys. I'll briefly highlight a few example findings from the 11 Latino advocate learners, and participants represented a range of backgrounds, including advocates, patient navigators, medical students, and individuals without formal healthcare or professional backgrounds across various age groups. The surveys assess things like familiarity with the FDA, clinical trial processes, learner self-efficacy and advocacy, and the perceptions of advocacy's influence on research and policy. A couple of questions measuring knowledge and self-efficacy were, how familiar are you with the FDA's role in drug development and the clinical trials process? And after taking the course, how likely are you to use your new knowledge to advocate for Latino participation in clinical trials and patient advocacy? As shown here, the course helped close the FDA and clinical trials knowledge gap, moving 63% of learners into high levels of familiarity compared to an 82% low familiarity observed in the pre-course assessments. We also saw that 100% of learners reported that they were either very or extremely likely to use their new knowledge to advocate for Latino participation in clinical trials and patient advocacy. When we measure the learner's perception of advocacy's influence in drug development and policy, we saw a very clear shift. Before taking the course, 73% thought advocates had just little or some influence in drug development and policy decisions, whereas after completing the course, that perception changed significantly, where 90% of learners believe that advocates had great or a lot of deal in influencing research and policy decision-making. I think what this suggests is that understanding how the research and regulatory system works can help advocates recognize where their voices can meaningfully contribute to research and policy discussions. Lastly, we also asked learners what they were expecting to learn from the course and what their takeaways were after taking the course. Learners saw a broadening of knowledge scope across the program's learning objectives, with all learners reporting increased knowledge across 4 core topics covered in the course, which are regulatory and clinical trials knowledge, and general and active advocacy knowledge and empowerment. So all in all learners reported leaving the course feeling more empowered, identifying advocacy and active engagement as a key takeaway. So as we think about the role this program can play moving forward, a question is how these programs can be integrated into the work many of you and your organizations are already doing to support patients and communities. So I'd like to turn back to you guys with the next question, which is, in what ways could community organizations, advocacy groups, or patient navigators use this course within their current outreach, education, or training programs? And we can start with Barbara.
Thank you. And first, it's a great course. And even with all the years I have been an advocate, after I took the course in English and Spanish, I learned a lot. So after being involved directly with Friends of Cancer Research for this project, I really appreciate the value of the course. One of the main missions I have is to train other patient advocates and caregivers to become advocates. Maybe because I'm a professor and teaching is what I have in my veins. I've seen a gap and a lack of Latino advocates for all these years that I have served as a patient advocate. So for the last many years, I've been training and offering Latino cancer patient advocate training program where we provide virtual and in-person training. The in-person training is part of Advancing the Science of Cancer in Latinos, offered biannually in Texas. So for this last group that we that participated in the conference last month in Texas, I'm going to require them to take the course as part of their virtual training. And what we'll do is have then a virtual training with everybody in it to discuss it. I think this course is going to be a good foundation for them to continue their journey as advocates and understand if they have to work with the researchers. I think it's understanding the complexity of the research because it's not, we all think it lasts too long, but we have to understand why research takes so many years. So I think it's a great foundation.
Thank you, Barbara. We're so excited to partner with your advocacy training program and many more to come. And again, the course is completely free as we offer this as a public service, and organizations can receive a unique token like Barbara did to track their advocates' progress, measure the course's impact. And if your organization is interested in partnering with us or learning more, please email us at clee@focr.org after the webinar, and we'll also share it in the chat. Building on the partnership discussion, I'd like to shift our focus a little bit to the unique perspectives that advocates bring to these spaces. And specifically, let's focus on Latino and or Hispanic patient advocates, since that's what our program's about. So what unique strengths do Latino and or Hispanic patient advocates bring to the conversations about trial design, research, or regulatory decision-making? And how can tools like progresoparapacientes.org help support those contributions while ensuring linguistic access and accommodations for advocates who may prefer engaging in Spanish? Debbie, I would love to hear you speak on this first.
Okay. This course that is Progreso para Pacientes will help so many Latino patients because when I started seeing that participation in clinical trials is very small, really 2-3% of Latinos participate in clinical trials, I've seen all the barriers that we have. I realized that really is very critical that we continue educating our Latino community to be effective and make sure that we can develop treatments for our community too. This program also is going to educate more Latino patients and caregivers, that is important, with the objective of more participation in clinical trials and drug development. Education is going to enable patient empowerment and engagement. Being well informed is important because it's going to enable patients to better communicate and work with researchers finding cures for our community.
Absolutely. Thank you, Debbie. And I think as important it is for patients to engage with researchers, it's also a bi-directional relationship from researchers to patients. So Diana, I would love to hear you speak more on this relationship.
Yeah, no, certainly. I think I've been chiming on the awareness train. So I think that Progreso para Pacientes provides users awareness of research and the importance of this engine of discovery to then work through clinical trials and identify whether those are safe and effective therapies that can be given to patients. And as we move on to a more personalized and targeted therapy world, where instead of just giving blanket chemotherapy to all, the medicines that are being created are more specific and tailored to a person's genomic background. And if, for example, the Latino genomics backgrounds are not being well represented in research, then some things may be gotten lost in the generation of those discoveries. So I think that by equipping the Hispanic community and the understanding of even how some of these tailored drugs are being generated, we will have better representation of Hispanics in like all the way at the beginning from when discoveries are first being made to make sure that those tailored therapies are also applicable to us. So I think that that's where that bidirectional relationship between the researcher and the advocate or the patient is so important, so crucial to bring awareness to the fact that not all genomes are the same. And that's why there's that need to bring the two together to better understand again those gaps and how we can best address them.
Thank you. Absolutely important. Again, the bidirectional relationship. We can all learn from each other. Collaboration is so necessary to move the field forward. That said, Yadira, I would love to hear your perspective as a caregiver in this decision-making process.
Thank you. So I'll start with saying that we as Latino, echoing a lot that Diana, Debbie, and Barbara have already shared about the expertise and experience that Latino patient and caregiver advocates bring to the conversation, to this process. And I'll share that kind of in our communities, family caregivers are deeply involved in medical decision making and kind of in general. And we also know that family caregivers are doing a lot of hands-on medical and nursing tasks in areas like cancer and transplant. And that gives us real lived understanding of what patients and families kind of go through. What is a therapy? What would an injection mean? How are we navigating the healthcare system? How are people thinking about joining a clinical trial? And so I think that that perspective is, again, incredibly important. The other one is the strong tradition of like family-centered care, and that decisions are often made together. I often talk about recruiting Latino older adults for brain donation after death. And that wasn't a decision only with the older adult, it was a decision with the family. Sometimes it was a decision with the individual's pastor or priest. And so I think as a collective culture, as a collective community, that is a perspective that we bring in terms of how does this work in communities and in systems? How can this inform protocols? Because the other part that also happens is the logistical components of this advocacy of participating in a clinical trial. If someone has a cancer diagnosis, is going through a clinical trial, they'll need support to get to that clinical trial. They may need admin support to navigate, how and where to get to what that study entails, or making that decision of like, does this make sense for me? Discussing that and providing family caregivers providing emotional support and assistance. And I think the other piece that is unfortunate is that this direct knowledge of structural barriers and inequalities. I talked a lot about my early and of why I came to this path of public health and in health, and it was because it was navigating the healthcare system with my family and being that my family and seeing that my parents perhaps weren't being listened to and having to advocate for them. And so I think that all of these things, the family-centered approach, the shared like decision making, are things that can really strengthen clinical decision-making processes and protocols and really inform them to make them patient-centered and family-centered.
Absolutely, Adira. Again, that language barrier is just another additional hurdle for people that don't primarily speak English, and it's very prevalent, and that's what we're here to address, and that's what you guys helped with, so thank you. So Barbara, I would love to hear your participation and your role as an advocate in these conferences, meetings, etc.
Yeah, first, I think it's important that we continue to build programs like this and that people know where to find them, right? Because part of, I think, lack of Latinos participating as advocate is because they don't know they could do it, right? And the two groups that I have trained, after the first training, they now have access to opportunities, to scholarship, to sit and bring what their community needs, right? So representation is key for the translation of research finding to the general community. Currently, Latinos represent 20% of the US population. So we need to know how drugs work within these communities. And moreover, clinical trials are the opportunity for people to get the drugs of tomorrow today. And if you don't participate, if we don't offer these trials to our people, they lose that opportunity that might save their life. We have seen drugs in clinical trials that have saved the lives of many people. And that's what we want our people to understand. So everyone should have the opportunity to participate. Bringing representation of these communities is important because participation ensures that regulatory industry and industry experts are hearing patient experience around coverage, transportation, and other things that Jadira mentioned. Because if when I sit with researchers, we can tell them, most Latinos have 2 and 3 jobs. They don't have paid sick days. They don't have family. Sometimes they are immigrants that don't have family that can support them. So all these are barriers that unless you sit down with your community or these communities, you will not learn. So I'm really happy that Friends is doing this course. And I think it's going to help shorten the gap of information our people have.
Thank you, Barbara. That's so true. Let's drill more into the improved trial inclusion and research outcomes and the relevance of evidence to diverse populations through accessible education and resources for Spanish language program or patient advocates or any other advocates. So Debbie, I would like to hear your perspective on this a bit more.
Yes, living here in Miami, we have a very large Latino community. We started a couple of years ago partnering with local organizations and some of the hospitals to educate patients in access to clinical trials and also to see what were the problems that we found. We did it in English, we did it in Spanish, and now this opportunity that Christine is offering with the Progreso para Pacientes, it's incredible because we are going to be able to nationally train more patients and we will be able to educate them about inclusion to clinical trials and research. Because if we don't participate, all the research and drug developments is going to happen without us, without a diverse perspective incorporated in that. So education, that is what we are doing here, will ensure that patients will feel that they are contributing to the development of new treatments for future patients too. This, I feel, that is our legacy.
Thank you, Debbie. And Yadira, would you please expand more on how ensuring evidence and research outcomes that are relevant to the communities matter in this sense?
Yeah, I'm having a reaction because I love that Debbie's last point about our legacy. So often our conversations around research and Latino center around like the barriers and the kind of the myths and more on like the why we're not doing it. I think the conversations around, in my personal experience, going back to the brain donation for science, conversations were framed around legacy. And this may not help us individually, maybe me, but I do want it to help my children or my grandchildren. And that was really effective in terms of getting our community to participate in that long-term epidemiological study and framing it as a community, as a family perspective. And I think that that is, I speak about that study and the Latino community, but I also think that those lessons learned can be applied to other communities that are also collective and make kind of are more communal in terms of family decision making. I think, and the other piece is I won't go ahead and repeat what Debbie mentioned, but just ensuring that, who is centered, the patient, the family, the caregiver, and that it's reflective of our community needs. That benefits all of us. So I'll just end it at there.
Thank you. And Diana, I would love to hear your perspective on why empowerment then impacts health outcomes, the processes, the decision making.
Yes, of course. I think that everybody's speaking about empowering through education, through awareness. That is the goal, to ensure that advocates are well empowered, have all the information available. And that is also going to help us talk about clinical trials as part of our everyday word. It's not something foreign. It creates trust. And it's trust on clinical trials as a means to identifying medicines that are potentially life-saving. It's also on the drug development process, an understanding of the need for representation of Hispanics as well as other races in all of this, all the way from discovery to clinical trials. So I think that my hope is that this awareness brings trust and brings empowerment to everybody who is taking Progreso para Pacientes.
Thank you, everyone. And yes, we keep coming back to this theme of empowerment, and empowerment comes with education, and through all of those combined comes trust in the system. So that said, when advocates and communities are equipped with resources, they can participate in these conversations to ensure that therapies and evidence being generated truly or realistically reflect the needs and the experiences of diverse communities and populations. So as our last wrap up for today's discussion, I'd like to ask each of you to share your takeaways from your experience helping develop progresoparapacientes.org and generally from the work that you do in your communities, and what do you hope organizations and advocates take away from all of our discussions today?
I'll start if you want. First off, I want to congratulate you guys for doing this, right? And not only doing it, but including people that know the community to do it, right? Because it's not the same to have somebody else talking about what we know, right? So first, thank you. And I think, as has been mentioned today in this afternoon, language is a huge barrier. Even 80% of, we have Latinos, but 70% of those Latinos speak Spanish at their home. And I have an aunt who has been living in Florida for 40 years. And 3 years ago, when she was diagnosed with inflammatory breast cancer, my cousin called me and she said, I feel very bad because I really need a translator for when they're going to give her a treatment because I don't want to influence, right? So even living many, many years, it's cancer. Listening to cancer is horrible. Trying to understand what cancer is, understanding the language is horrible. Try to picture yourself with somebody else talking to you while you look at the interpreter, right? So if something is easy to take away is the barrier of the language, and you guys are doing it. So I think we cannot stop here. It's just part of many challenges. We have to do more. And I hope to continue to collaborate to eliminate those barriers and provide many resources in Spanish to better educate our community. And like Diana was saying and Yadira, it should be something that people is not taboo or people think they're guinea pigs. We have to have everyday conversations of what clinical trials is. So the day you need it, you don't have to go through all this mind thing of fears and things like that. So again, thank you to you guys for doing that. And thank you for including me as part of the committee who work with you guys. So thank you.
I also want to echo what Barbara said, especially because I feel that there are many barriers, as she mentioned, for us Latinos to participate. And these barriers, we have to be able to, with this education, to be able to eliminate them or at least lower these barriers. Usually they are language, transportation to clinical trials, compensation to go to participate, time lost at work. So all these barriers are making it difficult for our Latino to participate. So with more education, we are going to be able to not allow, but just empower them, as we said, to participate and find cures for all. So this is just the first step, Christine. We are going to continue working together. So let's continue working just to improve care and also survival for our community.
No, that's so well said. And I want to also plug in something that Barbara said that we're normalizing the language, we're normalizing these concepts. I'm just so excited about this program because it has the ability to empower and activate Hispanic advocates who just may feel powerless. They just want to do something. They may hear of a cancer diagnosis given to them or their loved ones and they feel paralyzed. So I think that having this information helps them become activated so that they know where to go. The resources are widely available. They know that it's not something that's just happening to them. I think there's also like a lot of gain in not knowing that there are others that are going through the same. And that there are ways in which they can influence how they're being treated and ensuring that their voice is heard, which is huge.
I'll jump in, and it's hard to go last because it is like ditto on many of the things that have already been said. So I'll try to take it a little bit differently. And so I think one of the things is our role in helping address or advance uh, reducing health inequities. And for that, we need to kind of understand the needs, the preferences, and strengths direct from different communities, from families, and those that are most impacted. I love that Barbara shared the statistics in terms of who's participating in clinical trials, and this question about if we're not participating, then how is it, will they be effective and safe and efficient for people that look like us? And so I think that is incredibly important. But I also want to bring in my public health perspective. And we've talked a lot about navigating the healthcare system or healthcare delivery. I often think about quality of life and what do people want? What will the therapies, drugs enable them to do? And I am pretty sure that most of us won't say like I want to go sit in the doctor's office, but it's I want to spend time with my grandmother. I want to spend time, outside doing things I like. And so I think that that's the piece that is really important, to talk about our health comprehensively and what advocacy in the healthcare space means. And that is that we are healthy and well enough to do the things that we love to do and spend it with the people that we want to spend it with.
Thank you all. These are all very thoughtful reflections and so important to talk about. What really came through for me here is that this program is only one step in the broader effort to reduce barriers, because there are many, and strengthen advocate engagement through that and ensure that advocates have the tools and support needed to participate in research, clinical policy conversations. And again, this program is just part of that ongoing work, and there is more work to do. And continued collaboration and effort across the ecosystem is so important to ensure that patient voices are heard across all of these conversations. So that said, thank you for sharing your time, your stories, and insights with us today. And thank you to everyone who joined the conversation. We encourage you to explore the course and reach out to us with any questions. Thank you to our panelists again.